also has a paucity of samples in the months of April and May, since we did not have yet sequencing kits then, and we want to fill in this gap in sequencing for these critical months. Of the 14,517 sample sequence assigned with a lineage as of October 8, 26.2% of samples were positive for the Delta variant, 22.8% of samples were positive for the Beta variant, 20.2% or 2,935 samples were positive for the Alpha variant, 0.02% or 3 samples were positive for the Gamma variant. Among all the sequence samples in the Philippines, 69.2% of the 14,517 samples with assigned lineages were positive for the Alpha, the Beta, or the Delta variants. All 17 regions either have an Alpha, a Beta, or a Delta variant case. In the National Capital Region, all cities and the lone municipality were found to have a variant of concern. Also, 630 or 66.7% of the returning overseas Filipinos were positive for a variant of concern. A gradual increase in proportion of the variants of concern with respect to the total sample sequence has been seen at the national level since the detection of the first local Alpha and Beta variant cases. The variant of concern cases only accounted for 23.2% of the samples collected in the month of February. In March, however, the variant of concern cases comprised of 82.8% of the total samples. This increase has been consistent for the succeeding months. At present, for samples collected in September, the variant of concern cases now comprise of 97.7%. It is important to note, however, that only samples with collection dates in September only come from the first 2 weeks of the month. In addition, similar to other variants of concern, since the detection of the first local Delta variant case collected in April, an increase in the proportion of Delta variant cases were seen for the succeeding months. The increased proportion of these variants can be attributed to their increased transmissibility. However, sampling methodology also affects these proportions as samples from target areas or populations are prioritized more. Such populations or areas include samples belonging to clusters, severe or critical cases, admitted cases, samples from areas with sudden increase in COVID-19 cases, fully vaccinated individuals, and cases from returning overseas Filipinos. Infections from these populations are more likely to be associated with the variants of concern. In addition to purposive sampling, the number of sequences varied from month to month due to the limited resources available. Targeted populations have been prioritized in the sequencing runs done from May to June, which may have contributed to the skew of variant of concern cases for these months. On October 9, 11,010 new cases were recorded, bringing the total reported confirmed case to 2,654,450, of which 4.01% are active cases, 94.5% are recoveries, and 1.49% are deaths. Looking more closely at our active cases, 95.85% of these are either asymptomatic, mild, or moderate. 4.15% or 4,426 are severe or critical. For October 9, the top 5 regions contributing to these new cases are NCR, Region 2, Region 4A, Region 3, and CAR. The top 5 areas contributing to the new cases are Isabela, Cavite, Taguig, Quezon City, and Laguna. Looking at our epidemic, saw a steep increase starting the last week of July. The latest peak was during the second week of September, with daily average cases twice as much the daily average during the peak we saw last March of this year. We are seeing a decline in daily cases as we recorded 10,494 cases per day in the recent, which is a decrease of 28% or 4,195 from the previous week. Nationally, we are at moderate risk classification with a negative 2-week growth rate at negative 33% and a high-risk average daily attack rate at 11.43 cases for every 100,000 individuals, down from 17.10 in the previous 3 to 4 weeks. Most regions are showing negative rate, including NCR, regions 4 and 3. However, majority remain with the high-risk average daily attack rates. We are flagging CAR, regions 2 and 9, with high-risk case classification based on its positive moderate risk 2-week growth rate and a high-risk average daily attack rate. National ICU utilization rates at high risk at 70% utilization. 3 regions have both total beds and ICU utilization at high risk, which are CAR, Region 2, and Region 9. 8 other regions have either beds or ICU utilization at high risk, and these are Regions 4A, 11, Caraga, Region 3, Region 4B, 12, 5, and BARM. The National Capital Region shows a negative 2-week and a high-risk average daily attack rate and is currently at moderate risk case classification. The ADAR decreased to 18.31 per 100,000 population in the recent week. Its health system's capacity at moderate risk, with total beds and ICU utilization at 51 and 69% utilization. In the National Capital Region, the 7-day moving average shows a decrease as cases in the recent 7 days have decreased compared to the previous 7 days by 1,137 cases or 28%. The National Capital Region total bed utilization is on a decline, now currently at 53%. Since the start of August, total dedicated beds had been steadily increasing but has now been on a decreasing trend for the past week. From July 1 to October 8, the total beds increased by 15% or 1,391. However, with the increase in cases, the bed utilization also increased. From July 1 to October 8, occupied beds saw an increase of 65% or 2,176. Currently, the ICU utilization in NCR is at moderate risk at 67%. From July 1 to October 8, the total ICU beds increased by 400 or 36%. But occupied ICU beds also increased by 568 or 126%. The dedicated ICU beds have increased since August but has now been decreasing in the previous week. We also look at our national death curve. Weekly deaths started to increase during the last week of July and peaked mid-August. Since its peak, we see new peaks during the succeeding weeks, possibly because cases in other regions started later. As total deaths increased, deaths in Region 3, the violet bars, NCR, the blue bars, 4A, the teal bars, and 7, orange bars, also shows an increasing trend. Now we go for the most recent projections. There are several assumptions that were used. For the Delta variant, it is assumed that it is now the dominant variant in the region. For the vaccination, rates that were assumed are those that will achieve full vaccination of 90% of target population by year. For mobility, current mobility data were used for alert level 4, while it was assumed that mobility in alert level 3 will increase by 13 to 20%. For the health system capacity, current detection to isolation time is around 4 days, while that in August is around 6 days. And for the severe and critical cases, projections were based on regional and national percentages as of October 1. For the National Capital Region, projections were made if we continue alert level 4 or if we de-escalate to alert level 3. Projections were also made assuming 2 scenarios for the detection to isolation time. One scenario is the detection to isolation in August, which was longer at 6 days, and were estimated to be at 4 days. Looking at the projected cases by October 31, with a shorter detection to isolation time, daily cases may decrease to 1,731 cases if alert level 4 is continued, while 3,211 to 3,605 daily cases are expected if the National Capital Region is de-escalated to alert level 3. However, if detection to isolation time is again prolonged, just like what we have observed in August, daily cases may decrease to 2,195 daily cases under alert level 4, while 4,061 to 4,557 daily cases is expected if alert level 3 is imposed. This further supports our call to focus on reducing the time between detection and isolation, and to not only rely on measures that restricts mobility. Furthermore, we see a similar trend in our active case projections. If our detection to isolation time is maintained at 4 days, active cases in the National Capital Region may decrease to 10,100 cases by October 31 if alert level 4 is continued, while we may expect about 13,471 to 14,672 active cases when alert level 3 will be imposed. However, if detection to isolation time is again prolonged, active cases may decrease to 11,779 cases under alert level 4 and an increase up to 16,332 to 17,967 active cases if alert level 3 is imposed. In addition, when our 4-day detection to isolation time is maintained, severe and critical cases may decrease to 527 to 849 cases by the end of the month if alert level 4 is continued, while 703 to 1,235 severe and critical cases are expected if NCR is de-escalated to alert level 3. However, if detection to isolation time increases again, severe and critical cases may decrease to 616 to 992 cases by October 1 if alert level 4 is continued, and may increase to 855 to 1,516 severe and critical cases if alert level 3 is imposed. We would like to emphasize that these projections show how important decreasing detection to isolation time by case finding as one of our strategies in decreasing the transmission. While we see decrease in case projections, we want to see optimal decrease, and this will be possible by further shortening detection to isolation time. So for our key messages for this week, cases in the national level and the National Capital Region had been declining, as well as severe and critical cases being admitted. However, other regions such as CAR, Region 2 and Region 9 remain at high-risk classification with utilization rates at high to critical risk. The rate of decline in the National Capital Region cases, whether under Alert Level 4 or Alert Level 3, will greatly depend on our PDITR plus vaccination strategies. Shortening detection to isolation time must be maintained or further improved through active case finding and granular lockdowns in order to prevent increase in cases if we were to become more mobile. While we see improvement in our case trends, this is not the time to be complacent. We should maximize our gains and continue to aggressively implement our local responses. Not being able to sustain or improve the overall response lead to increasing cases again. Please continue to adhere to our minimum public health standards and avoid closed spaces, crowded areas, and close contact with other people. Yun lang. Maraming salamat. Lindsay, over to you. Lindsay? Lindsay?
Thank you very much to USEC National Case Trends. And I
Hello, USEC. Thank you very much po for your updates.
And before we proceed to our question and answer, I think you have an additional reminders po or additional announcement po to our partners.
Yes, bago po tayo magtungo sa ating question and answer, aming lamang pong i-anunsyo ang pagsisimula ng COVID-19 vaccination sa general adult population. Ayon po sa ating vaccine cluster headed by our vaccine czar, Secretary Charlie Galvez, meron na po tayong sapat na supply ng bakuna kontra COVID-19, mula ang pagbabakuna sa lahat po ng adult population. Ngunit patuloy pa rin po ang panawagan ng DOH na bigyang prioridad ang ating senior citizens at mga taong may comorbidities dahil sila po ang mas vulnerable sa malalang simptomas ng COVID-19 na dahilan ng pagkakaospital at pagkakamatay. Kaya marapat din po na mabigyan pa rin sila ng karagdagang proteksyon sa pamamagitan ng pagbabakuna. Tayo po ay patuloy na nananawagan sa ating mga A2 at A3 na patuloy po tayong magpabakuna. Ito po ay isa sa magiging proteksyon nyo laban sa malubhang sakit at pagkakamatay. Just announced that vaccinations will start among the general population, adult population, but we still need to prioritize our A2 and A3. Insay?
Thank you very much, ma'am. I will now be reading the questions sent to us by our media partners. From Caroline Bongkin, now that the World Health Organization already issued the definition and symptoms of long COVID, recognizing this could happen to COVID survivors, nasa table na po ba ang pagkakaroon ng post-COVID treatment centers?
Yes, Caroline, no? Dati pa naman recognize itong mga long COVID na tinatawag. I think that government will be efficient by establishing treatment centers for long COVID. Kasi yung atin naman pong current or existing hospital system, they can very well manage this long COVID symptoms. Ang kailangan siguro natin ngayong ipag-invest will be studies, no? That we can further study ito pong mga ganitong simptomas at mga taong nagkakaroon nito para alam po natin how we are going to manage them in the long run. So ngayon po may existing study na po with the DOST PCHRD. And ang title po nito is Genetics, Immunological, and Neurological Long-Term Consequences in Prospective COVID-19 Cohorts. And ito po kasama ang ibang bansa sa pag-aaral na to, katulad ng Thailand, ng Japan, at saka ng US, kasama po ang Pilipinas. So ang ating proponent po ay taga dito po sa Pilipinas, and ito po ay gagawin para sa mga may long COVID symptoms para mapag-aralan pa mas maigi. So, antayin lang po natin ito pong ating resulta ng mga ganitong pag-aaral para mas mabigyan pa tayo ng direksyon kung ano po ang dapat gawin ng ating gobyerno, pati na rin po ang ating mga clinicians.
Thank you, Yusek. From Sheila Crisostomo, nakikipag-usap na po ba ang Philippine government sa Merck or MSD para makasecure na tayo ng molnupiravir, and ano ang advantage ng Pilipinas na may clinical trials sila dito?
Well, kapag may clinical trial kasi dito, Sheila, syempre, mas magkakaroon tayo ng access. At ang pinaka-importante kasi, kapag dito ginagawa ang clinical trial, we can see the effect of these drugs among our population. And that is, alam naman natin na ang mga gamot, even vaccines, may mga iba-iba silang mga minsan na effect sa bawat race, no? Kaya tinitignan po sa lahat ng mga perspective yan. Kaya advantage for us because this is being tried now with our population and we can see the effect on this among Filipinos. Ngayon ito pong pakikipag-usap dito po sa mga manufacturers ng gamot na ito, atin pong tinitignan muna yung posibilidad. Unang-una, wala pa hong EUA ang gamot na ito, and our hospitals, if ever, will just need to use the compassionate special permit kung sakaling dumating na tayo dun sa punto na may rekomendasyon na. Pinag-aaralan po ngayon pa ho ng ating Living CPG Group, ito pong ating gamot na ito, itong molnupiravir, para makita natin kung talagang pwede siyang gamitin na ng ating mga kababayan kapag sila ay may mga ganitong estado ng COVID-19. Antayin po natin in the coming weeks, no? We will be releasing information about this.
Sec, may initial assessment na po ba kung effective ang alert level system para makontrol ang pagkalat ng COVID-19? And paano ang monitoring sa LGUs kung nag-i-implement nga sila ng granular lockdowns?
Yes, monitoring, Sheila, is part of this pilot implementation. Kailangan natin i-monitor, kailangan natin pag-aralan, kailangan may assessment para maging basihan kung tayo ay magro-roll out sa ibang lugar. Para maging basihan kung masasabi natin, was it effective compared to the previous restrictions that we had been doing. Pag tinignan ho natin ang ating trends ng mga kaso, nakikita ho natin bumababa ang ating mga kaso pati admissions. So kailangan lang ho natin makita na yung process na evaluation namin, how it was done in the different local governments, ano po yung mga naging positive factors o magandang nagawa, ano yung needs pa natin para ma-improve yan. At yan na po ang tinitignan natin sa ngayon, pinag-aaralan para kung magro-roll out na tayo, maituturo po natin doon sa ibang local governments what they are supposed to do.
Thank you, ma'am. From Giselle Report, sabi ng isang infectious disease expert, mas maganda raw na bakunado na ang mga mag-aaral bago isabak sa face-to-face classes. Anong masasabi rito ng DOH and posible bang isama sa pilot vaccination ng mga batang lalahok sa in-person classes sa November 15?
Base sa child health experts na kasama nating nagbalangkas nitong mga rekomendasyon natin for DepEd to start the face-to-face classes, ang unang rekomendasyon, yun ang ipinapatupad ngayon, ay gagawin ito sa mga mas nakakabatang mga young or children or school goers. No? So ito po yung mga below 12 years old na mga bata. At alam po natin, ang EUA po ng ating mga bakuna ngayon ay nasa 12 years old pa lang hanggang 17 years old for children. So wala tayong ganung bakunang available. That's one. Pangalawa, hindi pa ho natin nire-rekomenda ang pagbabakuna sa ating mga kabataan. Meron lang po with comorbidities. Pero para sa ibang bata, hindi pa rin po sila nabibigyan ng rekomendasyon ng ating mga eksperto. Dahil base sa datos, sila po may pinakamababang risk of getting infected, pinakamababang risk of getting hospitalized and dying from this disease. So ang ating strategy, ang gusto nila, experts have recommended, kailangan bakunado ang mga teacher at saka non-teaching personnel na makakasama nila dyan. And also, kailangan masiguro natin yung safety protocols para yung mga bata talagang safe sila dito sa environment na umpisa na po ang face-to-face classes.
Thank you, ma'am. We have several questions from Aiko and Giselle regarding Pfizer shots for 5 to 11 years old. Pfizer and BioNTech already asked US FDA to allow COVID-19 shots for children ages 5 to 11. Did the pharmaceutical companies reach out to the Philippine government or FDA to amend their EUA for the inclusion of 5 to 11 in the country's vaccination program? And nakikita po ng DOH na dapat nang isama sa vaccination ang mga ganitong kabata.
Katulad ng pagkakasabi ko kanina, we're starting with those children with comorbidities for 12 to 17 years old. As long as our experts ang sinasabi nga nila na hindi pa naman natin kailangan para bigyan ang mga mas nakakabata nitong ganitong klaseng bakuna ito sa COVID-19. Kailangan lang protektado syempre yung ibang miyembro ng households para we have that cocoon strategy or effect. Kumbaga, lahat ng mga kasama niya na adults sa bahay ay bakunado, mas magiging protektado ang ating mga kabataan. Pag dumating po yung time na meron ng sapat na rekomendasyon ng ating experts, at yan na po ang pag-uusapan sa IATF with the Department of Health. Pero sa ngayon po, ito pong sa Pfizer na 5 to 11, wala pa ho yatang naibibigay sa Food and Drug Administration na application for this dito sa ating bansa.
Thank you po, Yusek. From Donna Pazibugan, does the DOH feel it still has the vote of confidence from the medical community after the open letter of indignation from 69 leading physicians?
Yes, Donna, So, tuloy-tuloy lang po ang trabaho natin dito sa Department of Health. We respect the opinion of everybody. We respect the recommendations coming from all sectors and everybody. Nire-respeto ho natin ang malayang pagbibigay ng kanilang opinion sa public. Dito sa amin, sa Department of Health, the national government has always been transparent. The DOH, nakapagsumiti na po tayo dito ukol sa issue na ito sa mga kinauukulang ahensya investigations are undertaken at iwanan po natin doon at magbibigay po sila ng resulta dito po sa mga investigasyong ginagawa. Para po sa amin dito sa Kagawaran, hindi po namin kailangang tumigil at kailangan lang namin ipagpatuloy ang ginagawa naming trabaho para po masagutan natin ang mga issues ngayon dito sa ating pandemic response dito sa gobyerno.
Thank you po, Yusek. I will now be reading the questions sent to us via our Zoom chat. Regarding po the suspension of Moderna rollout in European countries from Lay and Dreo, how the decision of some European countries to pause the use of Moderna's vaccine on younger age groups affect our pediatric vaccination rollout? Will we still use the Moderna vaccine when we start vaccinating minors on Friday?
Yes, no? So ang pwede po dun sa minors natin, yung mga batang may comorbidities, ay ang mRNA vaccine. Sila po yung may EUA dito sa ating bansa at ito po yung para sa 12 to 17 years old. Pfizer and Moderna yan. Pag tinignan ho natin ang ating mga datos, even internationally, makikita ho natin na ang cases of this type of adverse reaction, yung myocarditis, is just less than 1 in a million. So ibig sabihin, it's very rare. So napaka-importante rin po talaga na yung monitoring natin, no? And sinasabi na ng mga experts even abroad, walang profile ang tao, no? Walang specific profile. Merong profile na younger males, pero aside from that, wala nang sinabi pa kung sino ang dapat bantayan. So lahat ng batang magkakaroon o bibigyan ng bakunang ito, atin pong imo-monitor maigi yan. Kaya ang napaka-importante, ang benepisyo outweighs the risk. Kailangan lang handa ang ating sistema to detect and to manage if ever this will happen. And that is why we initially did this pilot dito po sa ating mga ospital para mas mababantayan po ang ating mga kabataan. Kita natin na may capacity naman talaga tayo for us to be able to detect and manage this kind of reactions. We are now going to roll out in specific vaccination sites. Very careful po tayo lahat. Ginagawa po ng ating gobyerno lahat ng dapat na safeguards para po nababantayan natin ang mga ganitong reaksyon para po sa ating mga kabataan.
Thank you po, Yusek. A follow-up question po from Sheila Crisostomo. Ilan daw po ang participants from the Philippines and saang hospitals ito ginagawa? Kailan po nagsimula and target matapos? Regarding po ito dun sa DOST study on long COVID na.
This started, Sheila, about May 15 of this year, no? But for the other details, we will just be posting on the Viber group.
Thank you po, Yusek. From Dreo Calonzo of Bloomberg, given these projections, should NCR stay at alert level 4 or can we afford easing to alert level 3?
Yes, Dreo, no? Kailangan nating pag-usapang maigi to, no? So we have a series of meetings starting today hanggang sa Miyerkules para makapag-present tayo sa IATF. Hindi lang naman yung projections ang kailangan natin tignan. Kailangan natin tignan, will we be able, no, to maintain the current health system's capacity? Yung shortened detection to isolation, kaya ba, base sa mga ginagawa natin ngayon sa response, to maintain itong 4 na araw lang, no? Yung active case finding, mapagpapatuloy ba natin yan? Intensive contact tracing and testing, at saka yung immediate isolation. There will be factors na kailangan ikonsidera para hindi natin marating. Lagi natin tatandaan, projections ito. Pero pag nagawa natin ng tama ang ating response, these projections might not happen. And that happened already sa atin, di ba? Pinoproject nila dati na pag end of August, meron tayong ganitong numero na magkakaroon tayo dito sa NCR. Pero hindi yun narating. Dahil nagawa naman ng ating NCR local governments yung intensified, no, na PDITR. So hopefully maipagpatuloy natin yan para hindi natin marireach yung level na yan. And that can be a factor, no? That is a factor in our discussions with the IATF and the National Task Force if there would be a de-escalation if we continue the alert level 4 here in NCR.
Thank you po, Yusek. Follow-up question din po from several reporters. When exactly will the general adult population, when exactly will the vaccination of the general adult population start?
Actually, nai-announce na po ito, no, ni Secretary Charlie. Nire-reiterate lang po natin. Again, let me reiterate para sa ating mga kababayan, ito pong ating pagbabakuna sa general population ay nag-uumpisa na o pwede na umpisahan ngayon among our adult population. Pero gusto lang po namin manawagan sa ating mga local governments na sana po magkaroon tayo ng special or dedicated lanes para sa ating mga senior citizens at para sa ating mga taong may comorbidities. The rest of the population, adult population, maaari na pong magpabakuna. Let's prioritize also senior citizens and those with comorbidities.
Thank you, ma'am, from Red. Sa Sydney, Australia, may nangyari ng Freedom Days where nagluwag na sila ng todo sa mga restrictions, including social gatherings and bars. Hindi po ba magsiset ng Freedom Day na ganito ang Pilipinas? Or even in NCR, once we reach our set target na 70% full vaccination?
Well, pag narating natin yung mga ganyang level ng vaccination coverage, baka hindi lang day ang sasabihin natin, no? Baka ito ay magtutuloy-tuloy na, no? Hindi lang certain days ang ibibigay natin. Pero kailangan pag-igtingin muna natin yung mga ginagawa natin. That is our goal. That is our hope. That is our objective in the coming months. Sa ngayon, let us all focus. Let us not be complacent. Para magtuloy-tuloy po ang pagbaba ng kaso, magpabakuna tayo lahat so that we reach that coverage kung saan magiging protektado tayo lahat and we can have this kind of activities or events na pwede na pong magsama-sama, no? Of course, with minimum public health standards being implemented as well. Pero kailangan muna nating pag-igtingin lahat, ipagpatuloy, i-maintain at i-sustain ang ginagawa natin para tuloy-tuloy po ang pagbaba ng kaso.
Thank you, Yusek. Several follow-up po regarding pediatric vaccination. How ready po are our hospitals for the initial rollout on Friday? And tuloy po ba ang pagsisimula ng vaccination of children with comorbidities ng 12 to 17 this week?
Tuloy po. Nakapagsabi na po ang vaccine cluster. They will start on October 15. Hinahanda na po lahat ng ospital na kasama dito. Nakapag-orientation na po sila. Logistics are being prepared already. Kung tatanungin tayo kung handa sila as to technical capacity, yes. We have that capacity to detect and we have that capacity to manage this kind of reactions. Hindi po natin kailangan ikabahala dahil ibibigay ng gobyerno ito kung ito po ay makakasama sa ating mga kabataan. Lagi natin tatandaan kapag binigay because the benefits or the benefit outweighs the risk. Ibig sabihin, napaka-rare na mga event na mga reaction na ito. Kailangan lang, ang sabi nga natin, prepared ang health system natin to manage this. And we are prepared to do that.
Thank you very much po, ma'am. Yusek, kailan daw po mailalabas ang operational guidelines for the vaccination of the general population and children with comorbidities?
Meron na tayo actually, no? So I think it is being routed for signing, no? So siguro within the week lalabas na yan. Pero ito naman ay yung operational ay manggagaling sa vaccine cluster ang order para sa ating mga vaccination sites. That will be out and it will be disseminated to all of our vaccination sites.
Thank you, Yusek. From Inquirer.net, the remaining 170 samples, those that are not alpha, beta, or delta in the biosurveillance update, are those other lineages or do not have lineages?
These are other lineages detected, pero hindi pa sila classified ng WHO as variant of interest or variant of concern. So ibig sabihin, hindi siya walang lineage, pero hindi pa sila classified as VOC or VOI ng WHO. Kaya hindi sila sinasama sa ating report.
Thank you po, ma'am. And kailangan daw po ba ng registration ngayong open na ang vaccination for the general adult population?
Well, it will depend, no, on the local government units, no. So kapag sila po ang magsasabi kung talagang ayaw nila ng walk-in at kailangan may registration pa. So antayin lang po natin yung mga announcement ng bawat local government units natin dito.
Thank you very much, ma'am. Health workers from Lung Center of the Philippines, Philippine Heart Center, and National Kidney and Transplant Institute will be holding a lunch break roving picket later to condemn the 1 billion budget cut on maintenance and other operating expenses of all GOCC hospitals. They are upset daw po with Congress because allegedly the proposed DOH budget has not been even properly scrutinized. May we get your reaction on this one?
Yes, we are appealing, no. I think alam po ng ating mga medical center chiefs na nag-aapila ang DOH ngayon para sa karagdagang MOE budget ng ating mga specialty hospitals. No, and not just them, but all of our hospitals. May nagkaroon kasi ng cut doon sa budget natin, pero ibinabalik po natin yan at kasama po yan sa appeals ng ating ng DOH sa ating HOR at saka of course sa Senate. And doon nakausap naman po natin ang ating mga House of Representatives or mga congressmen and women at saka ang ating senators regarding this. They were very supportive at alam nila na kailangan ng mga ospital po natin ngayon ng karagdagang budget para sa kanila. So hindi po kailangan mag-alala po ngayon ang kagawaran ng kalusugan para maibalik po at madagdagan pa ang MOE budget ng ating mga ospital.
Thank you very much. Ma'am, last question na po from Greg. Over the weekend, Yusek Harris said that we might have a better Christmas with lower restrictions. Paalala po siguro sa public to avoid complacency.
Yes, Greg, no? So tutuloy na ako dun sa closing message ko ba, Lindsay, for this paalala.
Sige po, ma'am. Pwede po.
Sige, okay. So yes, Greg, gusto lang ho natin magpaalala sa ating lahat. Bagamat nakikita natin na bumababa na po ang ating mga kaso, bumababa rin po yung mga admissions natin sa ospital, bumababa ang positivity rate natin, hindi po ngayon ang panahon para maging complacent tayo. Kahit sinasabi natin na sa Pasko, baka better Christmas na, baka mas marami ng bukas, yan po ang ating hope, yan ang gusto natin at sana marating natin kung patuloy po nating pag-iigtingin ang mga ginagawa natin ngayon. Nakita na ho natin na kaya natin lahat pababain ang mga kaso kahit na gaano ka-dangerous ang variant na meron tayo ngayon, na nagawa pa rin po nating lahat na pababain ang kaso at mapababa ang admission. So hopefully we can be able to maintain all of this. Patuloy po nating pag-igtingin ang ating PDITR Plus strategy. Tayo po ay mag-comply sa minimum public health standards. Lagi pa rin po magsuot ng face mask, ng face shield. Lagi pa rin po mag-uugas at magsasanitize ng kamay. Do physical distancing. Kailangan po lagi nyo sisiguraduhin ang pupuntahan nyo ay hindi po pangit ang ventilation. Kailangan maayos ng hangin dun sa inyong pupuntahan. Lagi po kayong aware, lagi tayong focused dahil alam po natin na pwede tayong mahawa in any activity that we do. Kung tayo po ay patuloy lang mag-iingat, tayo po ay mapoproteksyonan dito po sa sakit na ito. And most importantly, magpabakuna na po tayo. Pag tumaas po ng tumaas ang coverage natin sa bakuna, mas magkakaroon po tayo ng tsansa na makapagbukas pa ng ibang sektor sa ating ekonomiya at maaring natin marating ang Pasko na gusto natin, yung better. So maraming salamat po sa inyong lahat. We will see all of you again on Friday and mag-ingat po tayong lahat. Thank you, Lindsay.
Thank you very much po, Yusek, and thank you very much to our media partners. Have a safe and productive week ahead po.